Welcome back to TV5 News at 9. It is time now for Aging in Style with McLaren. And joining us this morning is Michelle Crean, a clinical nurse specialist with McLaren Bay Region. Michelle, thank you so much for being here this morning. How are you?
I'm wonderful. Thank you for having me.
Yes, of course. You're welcome on any time. So today we are talking about the structural heart program at McLaren Bay Region. Now first, can you explain what structural heart disease is?
Of course. Structural heart disease is it's an umbrella term for conditions that are caused by defects or abnormalities in the heart's valves, walls, and or muscle. This can be congenital, meaning present at birth, or it can form over time related to aging, infection, or another correlated condition. So in a healthy heart, all four valves, including the mitral, the aortic, the tricuspid, and the pulmonic valves, they work together to pump blood from the upper chambers of the heart, which are the atria, to the lower chambers of the heart, which are the ventricles, to the lungs and the vital organs. And when one or more of the valves become damaged, the heart cannot function as efficiently as it should, and it can lead to serious health complications.
Yeah, we definitely don't want to mess around with our heart. So can you just tell us the team or who usually treats these structural heart defects?
Sure. Structural heart procedures require a great deal of expertise, and it should include a multidisciplinary team approach when making recommendations for intervention. Members of that team are going to include cardiologists, interventional cardiologists, cardiothoracic surgeons, heart failure specialists, cardiac imaging specialists, and anesthesiology.
All right. Seems very hands-on with a lot of great people, knowledgeable people.
Yes.
All right, good to know. Michelle, can you only treat structural heart abnormalities with open heart surgery, or are there other treatments?
No. So for years, structural heart disease was treated traditionally with open heart surgery, but now there are less invasive approaches available, including transcatheter-based approaches where a small incision is made in the groin or in the neck or just under the collarbone or even in the chest. And there are several advantages to doing minimally invasive procedures, including definitely shorter recovery time, shorter procedure time, shorter length of time that they're in the hospital, as well as fewer complications. And there are several types of minimally invasive procedures depending on the specific condition.
Now, are we able to talk about what types of non-invasive procedures are used to treat this heart disease?
Yes, absolutely. So McLaren Bay offers several types of minimally invasive procedures, and one of those would be mitral clip. And what this is, it's a type of transcatheter mitral valve repair, and it's a treatment option that may be available for some individuals with severe mitral regurgitation. And what mitral regurgitation is it's where the mitral valve leaflets do not close properly, and then some of the blood that should just be flowing forward, it should be a one-way blood flow, actually flows backwards through the valve. So with this type of procedure, a small implanted clip is attached to the mitral valve leaflets to more completely close, so that we don't have as much blood moving backward, and then that can help restore normal blood flow through the heart. There's also Watchman, and this is where a device the size of about a quarter is actually implanted in the heart, and it closes off the left atrial appendage, where in some people blood clots can form. And then this is an alternative therapy option for individuals who have irregular heart rhythms, like atrial fibrillation or atrial flutter, and they may not tolerate anticoagulation or blood thinners. And this, if they can't take the anticoagulation, they are at increased risk for stroke. So this is another type of therapy if they can't do that to help keep them safe. And then another is TAVR, and this is a minimally invasive approach for aortic valve replacement compared to open heart surgery, which is a traditional way for individuals with severe aortic stenosis. Aortic stenosis is when the aortic valve becomes narrowed or stiff, and it doesn't open as completely as it should, causing the heart to work harder to push blood through the aortic valve to the body. And I am excited to say that last week we performed our 200th TAVR, and we have an amazing structural heart program at McLaren Bay, and I am very blessed to say that I'm part of that team.
Yes. Well, congratulations on 200. That's an impressive number.
Very much.
Yes, of course. Now, of course, that we know some of these treatment options, which there seems to be an abundance of. What are some symptoms that we should really be on the watch out for?
So as with most heart conditions, symptoms can vary greatly from one person to another, but things that we'd want to watch out for are any kind of chest discomfort, whether it's pain, pressure, tightness, squeezing, achy, burning. It can be shortness of breath. It can be difficulty breathing when they're laying flat, like at night when they go to bed, they have trouble laying flat and being able to breathe appropriately, so they end up sitting up or sleeping in a recliner. It can be rapid fluttering heartbeat. It can be lightheadedness, dizziness, and for some even passing out. It can be edema or swelling like in the lower extremities. It can be fatigue. So things that they used to be able to do now really tire them out. Even as much as walking a short distance now causes a lot of symptoms or a lot of fatigue. So with non-emergent symptoms, we always want to make sure that we inform our medical provider. If we don't have a medical provider, we can always go and visit McLaren.org and click on Find a Doctor. We'd be gladly willing to help with that. And then in any emergent symptoms, though, we always want to make sure that we contact 911 to initiate emergent care.
Yes, great reminders, Michelle. Thank you very much. Is there anything else that you want to add about the structural heart program before we go?
No, other than we have an amazing program here at McLaren Bay, and if anyone would like to refer a patient or refer themselves, we have that information available for you.
Yes, yes, we do. All right, Michelle, it was a pleasure talking to you about this. It was great to learn more information. Thank you for coming on.
Thank you very much for having me.
Yes, of course. And if you do want more information, just head on over to the Aging in Style page on WNEM.com.